Hello, my name is Manila Razbandari. I had a chance to do a live simulation with expert by experience verbal interaction for 20 minutes with them. It was just for 20 minutes, but it felt like 2 minutes. The expert said that he was diagnosed with bipolar disorder 30 years before. When he found out about his disease, he was terrified. The side effects were getting worse. The expert said that it wasn't easy. It takes much courage to fight with yourself. However, support from his faith professionals and his family members helped a lot. He said that it is hard to control yourself and the judgment of the society. Additionally, the expert asked us why do we want to pursue our career as a mental health nurse. I want to be a mental health nurse because of the history of mental illness in our family member. My grandmother lived with mental illness for several years and didn't get any treatment at all because of unadvanced society and the country. When we started the subject mental health in our second semester, I thought that it's not just my grandmother. There are so many mental health patients who are not getting any treatment around the world, including my own country. um, so I want to help those people, but just the university knowledge will not be enough. So I want to gain as much as knowledge about the mental health and help those people in their recovery journey. um, he encouraged me to continue my plan and wished me a luck. Uh, he also said that he is not getting taking any medicines from the last 20 years despite of his illness. I asked him, was that hard for him? He said that it was hard, but the understanding of his family members and GP made him stronger. One thing I liked, he said, was the hope. Hope is something you cannot give to someone. It is something that grows in yourself. However, we can encourage someone to be hopeful, which is more than anything. The interaction was very inspiring to me. After talking to them, I understood they are actually an expert by experience. No one can understand more except the person who is suffering, neither the health professional nor the family members. I think they are so brave to talk about their mental health, recovering and fighting back with the mental illness. Moreover, it was an honor to talk with someone who recovered from mental health. I respect the courage they possess to talk about it with a stranger and change our perspective about the mental illness. But the mental ill I understood the medicine is just for the effects of the mental illness. Um, but the mental illness needs more support of people around that person. The recovery journey is challenging. It is hard to fight with yourself for yourself. I used to think that medicine will help, but after talking with the expert, my perspective changed about the medicine in mental health. A therapeutic relationship helped to develop recovery focused nursing practice is contributes to their recovery journey, but recovery is individual. Hope is a vital in recovery journey. Recovery gives purpose to the life of the individual and develops the ability to make their own decision. Recovery gives identity to their self-image. Excellent communication with the patient enable ones to recognize and the possibility of recovery and maximize self-determination. Recovery oriented practice is empowering and reassuring consumers to be responsible. Recovery is finding the meaning of their life and building the strengths. Nursing practice is balancing to support each other, each consumer, and duty of care for new opportunity for them. Recovery focused practice based on recovery, respecting and maintaining the dignity of the patient. The therapeutic relation includes evaluating recovery and partnership with consumers. In conclusion, the live simulation helped me to organize the thoughts about my mental health perspective. It was my pleasure to talk with someone who recover from mental illness and ask questions to them. When I talked with expert, I felt empathy. I felt powerful and courageous to help other to recover in future. Supporting and understanding of patient is the main role of the nurse.